Welcome to the Case Series Report. This is Chris Prue, Director of Education with Digitsole. This is where we do an overview of cases that are submitted to us by our professional clinic partners, so directly from our clinics to yours. So let's see what we got. This week's is diagnosis and treatment of a patient with Osgood Schlatter's disease. Fabrice Millet is a sport podiatrist in France, one of our clinical specialists who has a lot of experience in utilizing the product as well as specialty in lower extremity biomechanics. Make sure you check out his bio on the contributors page. So what we have here is a 12-year-old male. He's an active tennis player, and the chief complaint was anterior knee pain. And I believe that was on the left side. So, patient complains of a history of knee pain over the last several weeks, and it seems to be getting progressively worse, and it is causing some restriction in physical activity. So during Fabrice's examination, so he does find out that this particular young man is in a high level of physical activity, so he is a tournament tennis player, and certainly as a young person is also involved in his physical education component at the school level. Upon palpation, so it does reveal pain and some deformity in the form of inflammation right over that tibial tuberosity, so the anterior aspect where the patella ligament attaches to the tibia. Also notices weakness in single leg challenges, so where there's balance and single leg hopping. So he also sees that there's compensatory changes going on with increased in foot supination on that side, but actually shows that it is bilateral. So the differential diagnosis that was given was Osgood Schlatter's disease. And so quick background on that. So that typically occurs in the adolescent population as they're approaching the level of osseous maturity. And this young man is right at about that age. So he's 12 years old, and it's about 12 to 14 that we typically see this in young males. Oftentimes it's considered sort of an overuse injury to where there is excessive tension put on that patella ligament where it attaches. So you get that apophysitis, so inflammation at the attachment site of that particular ligament. Now, it can result in a pulling away, so there could be some additional inflammation in that area that also results in bony buildup. So Mr. Millet used the Digitsole system to do an evaluation in a lower extremity screening process through gait analysis. And so you can see this is the actual analysis right here. We look at the stride lengths, and they're fairly equal. So 1.1 meters, actually that would be very equal in terms of the stride length. And then we do have a fairly equal contact time as well as flight time on both the left and the right. So typically when we ask a patient, go ahead and walk at a comfortable pace, this is somewhat typical. It means that he's capable of managing the pain, not performing anything that is going to either cause pain, or as you can see here, he's at a level where the pain is actually not causing any sort of dysfunction to his movement pattern, at least with the stride step length and the relative percentages in contact and in the flight phase. So now we'll take a look at the corridor, and if you've listened to us before or are familiar with this, so the corridor in green is looking at and evaluating really the normative positions of specific demographics, age and gender, in the relative position of the foot towards the horizontal. So the horizontal is going to be the ground surface, and that's going to be at a 0 angle. So typically people are going to heel strike with a slightly inverted calcaneus and a supinated position of the foot. So we can see that he's on the lateral aspect on both of his feet. And then we also see at toe off, he has some significant variation as he's moving onto that first ray. So maybe some instability or, some compensatory changes that are going on because he might be too much in that supinated or inverted position, causing him to translate all of that pressure on the lateral aspect of his foot. So that can actually cause some increased tension on the patellar ligament as they're going through the gait process due to the influence that it has on the tibial rotation, either going into an excessive position, a malposition, or limiting that range of motion as a result of not being able to go through the appropriate mechanics as we get into that stance phase. Mr. Millay also used a video analysis, which was used to also provide some visual experience and comparative analysis to what they saw here on the scan, and it does prove to be very, very similar. So this was used to provide an intervention. So what was determined, because this patient was walking in a calcaneal inverted position or oversupinated position, so they decided that they wanted to provide some support mechanisms in that mid stance. And also to support that arch and maybe provide a little bit more motion into that pronated position as he's going into foot stance and minimize the excessive supination on that side. Also an insert to decrease and create a little bit more shock absorption on that heel strike, which also should decrease some of that condition, right? Because we look at this sort of overuse condition for Osgood Schlatters, and it's commonly seen in people that do a lot of jumping and sprinting, but a lot of deceleration. So think about tennis, where there's a lot of rapid acceleration, deceleration, and there's many of them over the course of a match. And so a reason that a lot of that eccentric loading and the malpositions of the foot could result in what was going on in this young man's condition. All right, so typically we see, this in the younger population, and if we get to it soon enough, we don't see any persistent bony changes, right? Because sometimes that inflammatory process can take long enough and result either worst case scenario, rupture of the apophysis. Apophysitis can result in some increase in bony formation in that area. A lot of times it's pain, can be somewhat self-limiting, but if they're a very active person, especially a tournament player, as this young person was, then it makes sense that we really want to intervene here and do what we can to improve the mechanics, decrease the overuse component to it, as well as perform some strength conditioning. So this young person had some interventions with regards to a decrease in physical activity, as well as some implantations into his footwear to decrease the malposition, as well as decrease the amount of shock absorption in the heel strike. So we say thank you to Mr. Millay for this fantastic overview on the intervention for a young man with Osgood Schlatter's disease. Please go to the website to view more of these case studies in their printed version, as well as the case studies in the video as we move through these. And also look up Mr. Millay's full bio in the contributors section and make sure that you follow him on social media. And again, thank you very much, Mr. Millay, and thank you for listening.